Do you have joint pain, stiffness, or swelling, and you also have psoriasis or a family history of it? You might have psoriatic arthritis, and catching it early is critical. Hello, this is Dr. Tambar from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Psoriatic arthritis is a condition that causes joint pain and inflammation in people who have psoriasis. It's often misunderstood, sometimes missed altogether. And when it's not treated early, it can cause long-term joint damage. You might be wondering, how do I know if I have it? Maybe your joints ache, maybe you've had a rash or some nail changes, or maybe you just feel exhausted all the time and don't know why. In today's video, I'm going to walk you through what psoriatic arthritis looks like, how to recognize it, and what you can do about it. Psoriatic arthritis is an autoimmune condition. That means your immune system, which is supposed to protect you, gets confused and starts attacking your own joints, and sometimes even your tendons and skin. It usually shows up in people who already have psoriasis, a skin condition that causes red, flaky, scaly patches, often on the elbows, knees, or scalp. But here's the tricky part. Psoriatic arthritis does not always follow the same path. You can have joint pain before you ever have a skin rash, or your psoriasis might be so mild that it never gets diagnosed. So if you're having joint problems and you or someone in your family has psoriasis, psoriatic arthritis should definitely be on your radar. Let's talk about the most common signs. You don't have to have them all, but if several of these sound familiar, it's worth getting checked out. Number one is joint pain and swelling. This is usually the first clue. People describe a dull, aching pain, often worse in the morning or after rest. The joints may feel warm or look puffy. It can hit big joints like the knees and small ones like the fingers or toes. What makes psoriatic arthritis different is that it can affect the joints unevenly. You might have pain in just one knee or one finger, or you might have many joints involved, or you might have spine inflammation involvement. Number two is morning stiffness that lasts more than 60 minutes. If it takes a while to get moving in the morning, that's a red flag. With psoriatic arthritis, the stiffness isn't just discomfort. It can feel like your body is locked up, especially in your hands, back, or feet. The next sign to look out for is dactylitis, or sausage fingers or toes. This is a classic sign in psoriatic arthritis. The whole finger or toe can get swollen, not just a joint. It looks like a sausage, and is caused by inflammation of the tendons, ligaments, as well as the joints. And then there's nail changes. Up to 80% of people with psoriatic arthritis have nail issues. You might notice pitting, tiny dents in the nail, discoloration, or the nail lifting off the skin. Nail changes often show up before joint symptoms. The next finding is foot pain or heel pain, or in this case called enthesitis. Psoriatic arthritis often affects where tendons attach to bone. This is called enthesitis. If the bottoms of your feet hurt when you walk, or your heels ache, especially first thing in the morning, that could be a sign of psoriatic arthritis. And then there's lower back pain or spondylitis. Some people get inflammation in the spine. This can cause a deep ache in the low back or buttocks. It's not just sore muscles, it's inflammation in the joints between your spine and pelvis. And then there's fatigue. This is one of the most common and frustrating symptoms. It's not just being tired after a long day. This is deep whole body exhaustion that doesn't improve with sleep. It can really affect your quality of life. So how is psoriatic arthritis diagnosed? Diagnosis starts with a detailed history and physical exam. I'll look at your joints, your nails, your skin, and I ask about your symptoms. What hurts, when it hurts, and how it's affecting your day-to-day life. There's no single test that proves psoriatic arthritis, but I may order blood tests to rule out other causes of joint pain and inflammation like rheumatoid arthritis or gout, imaging studies like x-rays, ultrasound, or MRI to look for joint damage or inflammation, skin and nail examination, even if the symptoms are subtle, the key is recognizing the pattern. Psoriatic arthritis tends to have a very specific combination of symptoms, even if they're mild. Untreated psoriatic arthritis can cause permanent joint damage. disability, and loss of function. It's not just discomfort. Over time, the inflammation can eat away at cartilage and bone. And unlike wear and tear arthritis, this damage can happen quite fast, sometimes in just a few months. That's why early diagnosis and treatment are so important. So here's the good news. Psoriatic arthritis is treatable. The goal is to reduce inflammation, relieve pain, and protect your joints from damage. Step number 1 is lifestyle and natural treatments. Exercise is key. Gentle movement reduces stiffness and pain. Walking, stretching, and strength training are incredibly helpful. Anti-inflammatory diet. Cutting down sugar, refined carbs, and processed foods can help reduce inflammation. Supplements like fish oil and curcumin may also offer some benefit, especially when inflammation is mild. The next step to consider are medications. When the inflammation is moderate to severe or widespread, we often recommend medications that target the immune system. These can include disease-modifying anti-rheumatic drugs or biologics, which are targeted therapies that block specific parts of the immune system. And then there's newer, smaller molecule inhibitors that are taken as pills. We always have a shared conversation with patients about the risks and benefits of each treatment, and we always aim to start with the lowest risk options first. Now let's discuss some frequently asked questions and misconceptions that I see. First question is, do I need psoriasis to have psoriatic arthritis? Not always. Some people develop joint pain well before skin symptoms develop, and their psoriasis may not appear until years later, or their skin issues are so mild that they go unnoticed. Another question is psoriatic arthritis the same as rheumatoid arthritis? No. They're both autoimmune diseases that cause inflammation that affect the joints, but they affect the body differently. Psoriatic arthritis often involves tendons and the spine. Also, it's more likely to cause dactylitis and nail changes, while rheumatoid arthritis does not typically cause skin or nail changes. Another question, can I avoid medications? If your symptoms are very mild and you're early in the disease, sometimes lifestyle changes and supplements are enough. But for more aggressive disease, medications are typically necessary to prevent joint damage and progression. Strongly recommend working with a rheumatologist that can assess the status of your condition and tell you what your risks are if you do not pursue treatment, so that you have a proper sense of the risks that you may be taking. If you have joint pain and any of the symptoms we discussed, especially if you or a family member has psoriasis, it's worth getting checked for psoriatic arthritis. The sooner we catch it, the better we can treat it, and the better your long-term outcomes will be. And remember, there are non-surgical, non-steroid options that can help you feel better and stay active. If you found this helpful, make sure to like, subscribe, and check out our website, chicagoarthritis.com, for more expert advice on staying pain-free and healthy. You can also reach out to our office directly if you need a consultation or want to discuss treatment options. Thank you for watching, live well, and I'll see you in the next video.